Okay, so I often use the term orthosteric ligands hijack the receptors, while allosteric ligands work in partnership. In practice, how can a drug developer decide when it's better to design an allosteric modulator rather than an orthosteric ligand, especially when both can achieve similar therapeutic outcomes? Well, the kicker there is they seldom would give you identical therapeutic outcomes. And the differences really come out in vivo because an orthosteric will preclude natural signaling and impose its own. But the nice thing about an allosteric is you can get it to be limited. So if you have for example, a NAM, and it's got an alpha of 0.1. All that means is that the NAM will produce a tenfold shift to the right of the agonist curve, and that's it. It'll stop. You have a limited inhibition. You can give as much of the drug as you want. Load up the animal, the person, and all you'll do is extend duration. You will not cause an overdose. An orthosteric, you do that, and you will cause an overdose because the more you give, the more you'll get. So you will link the duration with the effect. So that's one of the most attractive aspects of an allosteric. You are able to tune targets, slightly potentiate them, slightly inhibit them. Whereas an orthosteric, think of it as more of a crude hammer. You'll impose the effect, but you won't probably have the fine control you would have with an allosteric. So that's the main approaches or reasons why people go with allosterics. There are others, of course, as well, which we probably will uncover as we discuss other questions. But so the question was, how can a drug developer decide? Well, decide whether you want to take advantage of. There's about 14 properties of allosteric ligands that orthosteric ligands do not have. So if you read that list and say, "Ooh, I'd rather have this, not just an orthosteric," that pretty well answers your question. So that obviously, yes,